Welcome to Muslims and Mental Health with Sister Heather, a groundbreaking program looking at mental health issues through the biopsychosocial spiritual paradigm.
Welcome to another episode of Muslims and Mental Health. Today we will be concluding part 3 in our 3-part series of the psychology of aging, and we'll be discussing healthy aging with Dr. Cris Scaglione. Dr. Scaglione is a professor at the Chicago School of Professional Psychology of Southern California. She has training in clinical psychology with a specialization in neuropsychology, and she's worked with older adults for 20 plus years. And we're so happy to have her back today. So let's just get started. What does it take to have a healthy aging brain?
Well, there's a number of things, and we'll obviously talk about this in more detail. But let me start by saying, first of all, that there are normal changes that occur in the brain with aging, as well as abnormal changes in the brain. And both of these, though, can be improved. The loss of cognitive function that goes with these can be improved with some lifestyle changes, or an emphasis on certain things in one's lifestyle. When I say changes, I mean I'm referring to the fact that even if you didn't do any of these things prior, they will still help somewhat as if you start them as an older adult. So there's some good news there. Ideally, you've done this your whole life, or you've been doing it since your 40s. However, even if you start as an older adult to attend to your physical health through exercise and nutrition, and particularly attending to some specific health issues that we'll talk about, as well as attending to your psychological health, stress management, interpersonal relationships, that sort of thing, you can make a big difference in how your aging or aged brain functions.
Okay. And what kind of exercise is necessary, and how does that affect the brain?
Oh, okay. Almost all of the things I'm going to be talking about today have been shown to improve what we call cortical thickness, and I can explain that a little in more detail if you want, as well as brain networks. So the cortex is that the outer layer of the brain. It's sometimes I'll refer to it as gray matter. Mm-hmm. It's actually kind of pink, but gray matter is the outside, sort of the peel of the brain, and the inside is what we call white matter. The gray matter are the cell bodies of our neurons, and the white matter are the long axons or limbs of the neurons that communicate with other neurons. Mm-hmm. Most of our brain is actually made of white matter because our brain functions in terms of networks. A single cell, a single neuron will die if it's not connected with other neurons. Its function is to communicate. Mm-hmm. So the brain is a network of communicating cells. And so again, the gray matter is the outer layer of the brain, and the white matter is what's all packed on the inside. So almost like think of it as an apple almost, mm-hmm. or an orange, slightly thicker rind. With the outside peel being the gray matter, and the inside being the white matter. So networks are white matter mostly, and when I say cortex, think gray matter. Mm-hmm. So there's a little anatomy lesson, sorry. But all of the things I'm talking about, almost all of them are going to improve cortical thickness, which means you have more cells functioning, as well as cortical networks, the mm-hmm. ability or the systems by which skills get embedded, memories get embedded, is through the network that's formed between communicating neurons. Okay. So you started off with exercise. Even people who hate to exercise can exercise enough as an older adult to improve these two things, the white, the networks, and the gray areas. Two types of exercise are really helpful. Aerobic exercise, and I don't mean, getting out your old Jane Fonda tapes. I mean, take a walk, especially a brisk walk. The brisker the better. Okay, so 20 to 30 minutes of fairly brisk walking. And if you can't, you can start at 5 minutes and work your way up. Mm-hmm. And you only need to do this about 3 days a week. Mm-hmm. So that's not that bad. Even I can do that.
Although you could do Jane Fonda too,
We
right?
could do Jane Fonda.
And she
no.
does specialize on the elderly.
Yes. Well, actually, she has some new stuff out, right, for the elderly.
And she looks pretty good.
She looks fabulous. You also strength training, oddly enough. I think particularly women underestimate the importance of loss of muscle tone and loss of muscle mass as we age. And that adds to becoming feeble, it adds to fall risks, etc. So another advantage of walking is to improve the leg muscles, but strength training. Then again, you don't have to do the Arnold Schwarzenegger workout. You just have to lift things. And so if you do just a few minutes, 2-3 days a week, and a brisk walk. Ideally, you walk every day, but you can get away with a 30-minute, fairly brisk walk about 2 or 3 days a week. Mm-hmm. That makes a massive difference in how the brain functions. In addition to thickening the gray matter and the white matter tracts, it can contribute to something called neurogenesis, which is the formation of either new, not necessarily new neurons, but new connections between neurons. And it's really, really importantly also reduces inflammation. Mm-hmm. Many of our diseases, as it turns out, are inflammation related. There's a whole new science around this. And exercise reduces this. It increases blood supply. It increases the secretion of growth factors. There are many, many chemicals in the brain that are called growth factors that either repair or help neurons grow. All of this contributes to what we call plasticity, which is the ability of the brain to flexibly adapt to and learn and develop new pathways as new information comes in. It also improves executive skills because it's keeping the blood supply, which tends to be a little bit diminished in older age, to the frontal lobes. It keeps those pipes a little more open.
So along those lines, correct me if I'm wrong, but there's also the exercise of exercising your intellect too, right?
Indeed.
Which will do the same or have a similar effect on the neurogenesis, right?
Correct, and that's later.
Oh, okay.
So yes,
Okay.
physical exercise does this as well.
Okay.
And also, I just thought I did think of this also. It really also reduces depression.
Yeah.
So we were talking in the last segment about either depression as increased incidence in older adults or just as normal incidence, and actually walking around the block a couple times actually diminishes that greatly.
So just to add,
Sure.
so I was just thinking about with your strength training. I mean, you were talking about not being like Arnold Schwarzenegger, just simple things like milk cartons. I mean, daily things that you would use.
Yeah, and if you're flexible enough to be able to do something like yoga or slowed down Tai Chi, that actually can improve your strength as well as your flexibility. But yes, very simple swimming with those little water resistant.
That's fun. Yeah, the foam.
Oh yeah. Things
like,
that anything that produces resistance as you move is actually very helpful.
And okay, so let's look at nutrition a little bit here, and what is different about nutrition as we age?
One of the things that's different is we tend to not need as much food, and that takes some adjustment. But we'll need less caloric intake, but we need relatively higher levels of protein. A lot of older adults tend to not get enough protein, so that's one thing that's important. Have a little bit of protein each meal. It helps particularly with slowed down digestion and reduced appetite to also eat smaller, more frequent meals during the course of the day, which also manages blood sugar much better. We could do a whole segment on that, but things that you should add to your diet, or make sure that you include in your diet, that are extremely helpful for brain health are the omega fatty acids. So there's 3, 6, and 9, but there's also a 5 and a 7. Now,
Don't hear about those very often.
Yeah, you don't hear about them very often at all. I forget what 7 is actually, but I know that 5 has been omega acid number 5 is fatty acid. Number 5 is found in macadamia nuts, which is a very happy thing for me. So that would be nuts, fish.
Well, we're very close to
flaxseed.
Hawaii, so
Yes.
that's a bonus.
There you go. So you get, a macadamia nut encrusted piece of fish, you're set. Vitamin D is very important for older adults. It actually improves immune functioning, reduces our chances of getting infections, etc. But it turns out that vitamin D is actually a neurotransmitter. There's some recent work on that. So vitamin D actually is very helpful to take, as well as any of the B vitamins, but particularly what we call folate or B9, which tends to be more important in older adults. There's also something called polyphenols, which are very helpful, useful chemicals for overall health, but also brain health, and they're found in fruit, particularly the colored fruits like the berries, that sort of thing. Apparently a cup of blueberries is very good for you. A very happy occasion for me as well. So I love blueberries.
And so what does the polyphenol do?
Polyphenols tend to be antioxidants and anti-inflammatory.
Oh, okay.
So they help just with overall brain health and overall immunological health, as well as cardiovascular health. So it's a good bargain. These things also change how the brain uses calcium, which is a very important in cellular functioning of the brain. So again, fatty acids, fruit, vitamin D, and vitamin B9. Those are, if you can remember all that, you're in good shape.
A lot to consider there, but important information. Do nutritionists tend to specialize as well?
Some do. Some do. It's kind of a new area though.
Okay. And what about we know as how people have done that care for self, as you talk about, through their younger years into their older years, they can tend to develop things like high blood pressure. So what is it, and what is high blood pressure, and why is managing it important?
There are many health things to watch for as an older adult, of course, but in terms of brain health, the number one risk factor for a stroke, which is it can be potentially devastating injury to the brain, the number one risk factor for that is high blood pressure. It's something that you don't notice. It's something you rarely notice. If you notice, it's like too late. But it's one of those things that you really don't know if you have it unless you have it monitored. You want to keep the blood pressure around 120/80. That's considered normal. It can go up a little higher than that, but you certainly don't want either a steadily high levels of blood pressure, nor do you want it to vacillate. There are people who will take their medication sporadically, or it's very difficult to control the high blood pressure, and the peaks and drops in it are very, very high risk factors for a stroke. I do a lot of stroke evaluation and rehab, and it's a really difficult thing to come back from. So if there's nothing else that you get checked, even it's an even higher risk factor than high cholesterol, which is another risk factor for stroke, because if you've got fat blocking things and debris is getting stuck to it, and you'll eventually possibly toss that little bit of stuff, fat and whatever else is attached to. That's a type of stroke as well. But even more importantly is the high blood pressure. So it's really, really crucial to take care of it. And of course, exercise and nutrition also help with high blood pressure, as do meditation and other sorts of things. But medication might be necessary. It's one of the things that one type of medication never to mess with is your high blood pressure medication. Make sure you take it.
But there tends to be a correlation, right, between weight loss or doing exercise and the blood pressure lowering.
Yes,
and,
sometimes it can be managed with lifestyle alone, but don't assume that. Always keep getting it checked, and if medication is indicated, stick with it.
And okay, so this is a good place for us to take a break. I have some more questions I want to ask you, but we'll take a break and we'll come back and ask you some more.
Okay.
All right, thank you.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.
Welcome back to Muslims and Mental Health. Today we're discussing the psychology of aging, particularly healthy aging, with Dr. Scaglione. We're going to continue now and talk about stress management. So what can you tell us about stress management?
Okay. Well, actually, it brings me back to before the break. We were talking about high blood pressure. Stress, high levels of stress, of course, contribute to high blood pressure. And one thing I had neglected to mention was that blood pressure related changes in the cardiovascular system and the brain also contribute heavily to things that we were talking about in the previous episode on vascular depression and vascular dementia. These can contribute to mood changes and cognitive decline. Also, one of the things that we haven't quite been able to clarify yet, but it's being looked into, is that the disease of Alzheimer's is almost always accompanied by vascular changes, and much of what we consider to be the typical Alzheimer's dementia is actually due to clots and small bleeds and vascular changes in the brain. So it's, again, really important to deal with high blood pressure. Again, stress is high levels of stress contribute to blood pressure problems. It contributes to mood disorders, etc. And the chronic effects of stress and trauma, as we're now learning, actually affect brain structures in very unhelpful ways. High levels of trauma, even from childhood, actually can affect brain structures, particularly the ones that are important for memory, as well as mood and emotional regulation. So if somebody has had a history of trauma and stress, this is particularly important to learn through the lifespan, to learn how to handle stress and handle the things that life throws at you in a way that is calming, in a way that is restoring the equilibrium of one's mood and one's mental state, one's body. Severe stressors often precede a huge cognitive decline, again, because of the brain changes involved with it. So there's many ways to handle stress. There's, again, that you could probably do whole episodes on that. But
so we just did before this one.
Good.
We had an episode come out about mindfulness and the importance of being mindfully grateful, and we kind of did talk about stress and how, as I have been taught, how you can eventually the hippocampus can be overridden.
Yes.
And exactly what you're touching on, I believe, and so then there's no fail-safe anymore. Right.
And the strategies that normally work, the ability to talk to yourself down, essentially, and to calm yourself down, is impaired because the limbic systems, the limbic structures, are screaming too loudly, essentially, to allow the frontal lobe to do its thing, and that's to inhibit all of that kind of emotionality.
And now that's not reversible, right?
It is reversible to some extent. If it's gone on for a very, very long time, it's only partially reversible. Treating somebody as if they had a depression or an anxiety disorder actually helps somewhat. The same kinds of psychiatric and psychological protocols will help. But yes, if it's been childhood trauma or PTSD for many, many years, that some of that's not reversible. Two of the things that we know for sure are very helpful are meditation. I'm glad you did an episode on mindfulness, and also social supports, and all the kinds of things that, again, you probably already talked about it as handling stress. Some of the
actually, we haven't talked about that part.
Oh, you haven't? Okay. So from an older person's perspective, we'll stick with that. The wise choices that we talked about in one of the first, the previous episodes, of choosing a life that is meaningful to you, choosing people that are helpful to you, cutting out the stressors, cutting out the compromises that you make that are too profound, and maintaining a lifestyle that is emotionally enhancing. Those are all very, very important things. Social support. You know what? It turns out that a glass of wine a day is also probably pretty good for people in terms of cardiovascular health, even brain health, and stress management. More than that's not so good. But so there's some very simple things that people can do.
So I want to circle back to the social support just for a minute more, because I light up every time you talk about meaning, because I like logotherapy.
Okay.
So, but, you know, I think as, you know, our older adult population who might be watching, there are other ways of getting social support other than just with your peers. You
Absolutely.
can give back, and, you know, one thing that I've so appreciated are the mentors in my life, and I just think that's one way in which people forget how they could be useful.
Yeah.
And that provides us a level of social support. It's not the same as their peers, but it's still something that gives that interaction, that connectiveness.
Absolutely.
That, you know, they might not be able to get from their peers anymore, maybe because they're gone or something. But
Well, it's actually very important for older adults to make friends with and have social networks that are not age peers, because as they die off, essentially, I mean, if you're going to be direct about it, you lose so much of your world. It's actually really helpful to befriend and to interact with younger people. In an earlier episode, we talked about Erik Erikson's stages of older development, and one of them is generativity, and that is essentially the ability to understand that you have things that are valuable, and you're going to now give that away, and it gives your life meaning and structure and connectedness. And yeah, so if you have the energy and the ability to volunteer, teach kids how to read, something, it makes your life so much more rich, gives you a lot more of a baseline of a foundation that is suited to handling stressors.
And so, so switching gears a little bit, but in a similar vein, how is engaging the intellect and social activities different as we age, and why is this important?
Gotcha. So you had touched on this earlier. Being actively engaged in the world is very important. The passive activities, such as, say, watching TV, is sort of the ultimate passive activity. Fine, do that for a while, but to actively engage the world is, in any way, whether it's a social way, whether it's physically, whether it is through intellectual activity, is really, really important. This lights up the brain, and it's it could be socially. It could be just having a good laugh and playing cards with friends at the end of the day. Staying in touch with people through Skype if they live far away. And as it turns out, each activity you add in your life as an older adult, as long as it's not overwhelming, actually helps improve emotional and cognitive functioning. So let's say you just go bowling. Well, now you're going to go bowling and go for a walk. Or now you're going to go bowling, go for a walk, and have dinner with a friend once a week. All of these things incrementally improve brain functioning and cognitive functioning and emotional functioning. Now, you don't want to exhaust yourself, but it's active, committed engagement with physical movement, with social activity, and intellectual activity. The really important thing about the intellectual activity is that it should be difficult. Actually, the effort component of learning really lights up the brain and improves neural networks. So learn a language. Learn a language that's different from your own. Use a different alphabet. Learn how to play a musical instrument. You can play it badly if you want. Just learn it. It's really difficult, but that's good. Read things that you've never heard about before. If you can travel, wonderful. If you can't travel, watch the Discovery Channel, learn about places, learn about new things, and keep really actively engaged.
Because there is something different, right, about learning something completely new.
Yes.
It affects your brain a little bit differently, right,
Quite a
than just adding to something you already know.
Right. And that also speaks to, earlier we were talking about exercise improving neurogenesis. Active, difficult, effortful learning also improves that. So again, that helps with what we call brain plasticity or flexibility, brain growth, maintenance of networks, the forming of new networks. There's also a concept talked about in older adults that's either called cognitive or neuronal reserve. And that is that, and there's many sources of support for this, but people who have had a lifelong pursuit of difficult things, and people who have gotten at higher levels of education, or if they didn't get formal education, at least were well read, very interested and engaged in the world, that apparently serves as a protective factor, even if they're genetically predisposed to, or have other risk factors that predispose them to a dementia. You can actually be demented or have a dementing process, but still retain a lot of intellectual function if you have this reserve. The good news also, though, is that even if you didn't have that reserve, if you begin that pursuit, if you begin the active involvement and the exercise and the intellectual pursuit, it can be still protective against some of the not so kind things that can happen to your brain as an older adult.
That's really promising, especially when we know there are segments of our society and populations that have been discouraged from education. That this is an opportunity now to do something that they were denied before. And that it actually has benefits beyond the obvious.
It does.
So that's fantastic. Okay, so and then, is there anything else you'd like to share about mental health care and aging?
Well, mental health care that's available in aging is sadly lacking. But what I can say about mental health is, I think, probably a repeat of something I've said earlier, and that is, in addition to the activity and the engagement that I've been discussing today, that trying to balance autonomy with relationship and meaning is really where the work is, and where the helpful engagement is. I think that's all I would add to that.
Logotherapy has been shown to be effective.
Indeed, logotherapy is, because meaning is so important.
Yeah, logotherapy means meaning therapy, just in case, people.
And it's logotherapy is also really appropriate for the existential issues that come up as an older adult. What is the meaning of my life? Why have I been through all this for nothing, or has there been something meaningful that I can find and perhaps even leave for others?
Yeah. Well, great. So thank you so much, Dr. Scaglione, for all the information you've given us in all three segments. It's been really enlightening. And I think that our audience will gain a lot from all this information that you've imparted. I'm going to transition one more time to some fun questions. And ask you this time, so they're a little bit more serious than usual. But so in terms of psychology, who would first, what would be your favorite theory and why? If you have one.
Yeah, one of the reasons I liked anthropology before I went into psychology was that it had a very wide scope. One of the things I like about psychology is potential has a very wide scope as well. One of the reasons I like neuropsychology is not because it's so highly specialized, but because it's where spirit and development and psychology meet biology. It's a very active, interesting place. So I have many theorists that I like and many theorists that I draw upon. In neuropsych, I'd probably we're all indebted to actually a Russian, Luria, who did a lot of very good clinical work around neurology and neuropsychology. In terms of how I work, I tend to be actually part of my training and part of my inclination is to appreciate the work of object relation theorists, or what they call ego or self psychology. So that would be Kohut, Kernberg, I've actually viewed people from that. It's sort of an attachment model, what also fits well with what we know about primates and human development. And it works well in terms of working with people with dementia and brain injury, that sort of thing, the people I tend to work with the most. Also, existential theorists are important to me. Gestalt Theory. Virginia Satir is actually very Gestalt. In fact, much of Gestalt is actually Virginia Satir. She and the Pearls were very close friends. Because it helps people engage with the really difficult questions in life that come up after dementia, brain injury, amputation, that sort of thing. Those are the people I tend to work with.
Thank you again. And,
You're welcome.
Hopefully sometime we'll have you back.
All right, thank you.
So, okay, this concludes part 3 of our 3-part series on the psychology of aging. Thank you for joining us. If you have any questions, comments, concerns, please email us at nafshealertherapy@gmail.com, NAFSHEALER therapy@gmail.com. Thank you.